CommonWell TV live from Las Vegas, Nevada and HIMSS 16. Boy, this hall is buzzing. It's very, very exciting. Why? Because we're now at athenahealth. I'm with Doran Robinson, Vice President with athenahealth. Great to have you. Thanks for joining us. Thank you for your nice warm welcome. Let's jump right into it, Doran. What feedback are you hearing from clients using CommonWell cross-vendor interoperability services?
Well, today we've rolled out the CommonWell services across our entire base of clients using our clinical EHR. And the feedback has been overwhelmingly positive. In particular, the providers that are using the service are finding the most value out of having a clear picture of essentially what the last provider who saw that patient thought. The emphasis has been much less on access to discrete data, like a problem list or a med list, and more about the notes or the narratives from the last visit that patient had. That's been incredibly valuable in the eyes of our providers. I think we've also learned that, and this is true I think for a number of different vendors in the space who are deploying the services, that the discrete data that are moving, the labs, the problem lists, the medication lists, the allergy lists, are valuable, but the work that's associated with incorporating those data into the primary medical record is something that we still need to work on. And so it's been a very important learning experience for us, but our providers have found this to be incredibly valuable in the early stages of deployment.
So how does CommonWell fit into athenahealth's vision for interoperability?
Well, Athena's vision has always been about building a national health information backbone that helps make healthcare work as it should. And as part of that vision, we have always imagined that the world will develop as a network of networks. There's not one single system that will hold all of the information for a patient. As information is local, you'll likely see connections to local regional hospitals, connections to state health information exchanges. But the value of CommonWell and making it really cheap and easy to connect all these different silos of care is really critical to that future. CommonWell, Athena was a founding member of the CommonWell service, and as such continued to champion the value we believe is behind it. But it doesn't mean that CommonWell is the only thing that's going to move the network, to move networks forward. We're also members of the Care Equality Alliance. We use the SureScript services. So CommonWell plays an important role in the development of this future interoperability state that we've been talking about.
So what perspective would you share with organizations who are still on the fence about joining something like CommonWell?
I'd have you ask why not? I think our membership is open to all health IT organizations. We have made meaningful progress with a group of very committed vendors in the health IT space in terms of breaking down the barriers that are associated not only with the technical challenges of making information move and making it liquid, but the partnership and collaboration that's required at the leadership level across these organizations. So I think if you're contemplating joining CommonWell, even if you may not be in a position to deploy the services, being able to be part of a group of leaders in the industry that you can spend some time with to learn and understand the challenges that they're facing and how they're approaching the space, I think can add a tremendous amount of value to your organization.
So where can people go to learn more about athenahealth?
Well, here in the HIMSS conference hall, we're in the 3200 row in the impressive space we're in here. You can also always find us at athenahealth.com.
All right, Doran Robinson, Vice President of athenahealth. Great to have you. Thanks for joining us. Thanks again for the warm welcome.
Thanks.
CommonWell TV signing off from Las Vegas and HIMSS 16.